Your legs are lying to you. Right now, while you're sitting there feeling perfectly fine, your veins could be silently clogging, and your body has been sending you warning signals you've been completely misreading. There is a 30-second test you can do right now, sitting exactly where you are, that will tell you more about the state of your circulation than most routine checkups ever will. And here's what disturbs me. 90% of people over 60 who take this test for the first time fail it. Not because they're sick, because nobody ever taught them how to listen to what their body is screaming at them. What you're about to discover could be the most important 30 seconds of your health journey this year. Stay with me until the end, because the #1 circulation strategy I'm going to reveal today was tested in a clinical study where participants saw a 44% improvement in vascular flow in just 11 days. 11 days. And almost nobody over 60 is doing it. By the time this video ends, you will know exactly what to do starting tonight. I'm Dr. Thomas Ashford, a physician specialized in senior health with over 15 years of dedicated clinical experience. I've worked with thousands of men and women over 60 who came to me frustrated, tired, and scared, convinced that what they were feeling was just normal aging. Cold feet in the middle of summer, legs that ache after a short walk, swollen ankles by dinner time, wounds on their feet that take forever to heal. They were told again and again that this is just what getting older feels like. I refuse to accept that. And after everything I've seen in my clinical practice, I refuse to stay silent. What I'm about to share goes against the comfortable, passive narrative most people receive from their doctors, but the science backs every word of it. Before we continue, I want to ask you something. Do you ever notice your feet feeling cold even when the rest of you is warm? If that happens to you regularly, type cold in the comments below. You might be surprised how many people share that exact experience. Now let's talk about what is actually happening inside your body. After 60, your circulatory system undergoes changes that most people never fully understand. The walls of your blood vessels begin to lose elasticity. A process called arterial stiffening means your arteries can no longer expand and contract as efficiently as they once did. At the same time, the inner lining of your veins, a delicate layer called the endothelium, becomes more vulnerable to inflammation and plaque accumulation. Your blood itself changes too. It tends to become more viscous, meaning thicker, which makes it harder for your heart to push it all the way down to your feet and back up again. Here's what that means in practical terms. When circulation is compromised, your extremities, your feet, your calves, your hands stop receiving adequate oxygen and nutrients. Nerves begin to misfire, muscles cramp, tissue repair slows dramatically, and your immune system, which depends on blood flow to deliver white blood cells to where they're needed, becomes less effective at protecting you from infection and injury. A study published in the Journal of Applied Physiology found that adults over 65 show an average 38% reduction in peripheral blood flow compared to adults in their 30s. 38%. That is not a minor inconvenience. That is your body operating at a serious deficit. And here's what terrifies me most. Poor circulation doesn't just affect your comfort, it triples your risk of dangerous blood clots. It dramatically increases your risk of peripheral artery disease, which can lead to limb-threatening complications. It impairs kidney function. It slows cognitive performance because your brain, which consumes roughly 20% of your body's oxygen, is no longer getting what it needs. And it makes every single other health condition you're managing significantly worse. But here is what gives me hope every single day. Circulation is one of the most responsive systems in the human body. With the right interventions, people over 60, over 70, even over 80 can dramatically improve their vascular health in a matter of weeks. I have watched it happen hundreds of times. And it begins with awareness. It begins with that 30-second test. So let's do it right now. And then I'm going to walk you through the 7 most powerful strategies for restoring your circulation, ranked from least to most effective. So by the end of this video, you have a complete, science-backed action plan you can begin immediately. If this is already sounding valuable, go ahead and hit that like button right now. It helps more people over 60 find this information when they need it most. The 30-second circulation test. Here is exactly what to do. Sit in a chair with both feet flat on the floor. Now lift both feet off the ground and extend your legs straight out in front of you, parallel to the floor. Hold that position. Now point your toes down, away from you, as far as they'll comfortably go. Then flex them back up toward your knees. Do that 5 times slowly. Then rotate both feet in a circle, 5 times clockwise, 5 times counterclockwise. Now set your feet back down on the floor and wait 30 seconds. After 30 seconds, look at the tops of your feet and your lower legs. Then press your thumb firmly into the top of your foot for 5 seconds and release. What are you looking for? 3 things. First, do you see any redness, bluish discoloration, or mottled patchy skin on your feet or ankles? Second, when you pressed your thumb into your foot, did the white indentation from your thumb take more than 2 seconds to return to normal skin color? That is called prolonged capillary refill time, and it is a direct indicator of sluggish circulation. Third, during or after the foot movements, did you feel any cramping, tingling, numbness, or aching in your calves or feet? If you noticed any one of those 3 signs, your circulation needs attention. If you notice 2 or more, your circulation needs serious and immediate attention. And if you passed all 3, wonderful, but stay with me, because what I'm about to share will help you keep it that way for decades to come. Let's move into the 7 strategies, starting with number 7, the least powerful on this list, but still significantly more effective than most people realize. Number 7, temperature contrast therapy. Most people treat temperature as pure comfort. You take a warm shower because it feels good. What very few people understand is that strategic use of temperature contrast is one of the most scientifically validated methods for forcing circulation improvements in the extremities. Here's the mechanism. When you expose your legs and feet to cold water, your blood vessels constrict. When you follow that immediately with warm water, they dilate. This rapid back and forth creates what researchers call a vascular pumping effect. You're essentially exercising your blood vessel walls, training them to respond quickly and efficiently. Over time, this restores elasticity and dramatically improves peripheral blood flow. A study published in Frontiers in Aging found that participants who practiced temperature contrast hydrotherapy for just 10 minutes daily showed a 26% improvement in peripheral circulation after 3 weeks. That is a meaningful change from simply adjusting how you use your shower. Here is how to do it correctly. At the end of your regular shower, alternate between 30 seconds of the coldest water you can tolerate on your legs and feet, followed by 30 seconds of warm water. Do 4 to 5 cycles. Always end on cold. Many people make the mistake of ending on warm, which causes the vessels to stay dilated and can actually leave you feeling more fatigued. End on cold to trigger a final vascular rebound. Pro tip: if stepping in and out of the shower feels unsafe, fill 2 basins, one with cold water and one with warm, and alternate dipping your feet. The effect is nearly identical. Safety always comes first. Number 6, compression and elevation timing. This sounds almost too simple to be on a list like this. But the science is clear, and most people are doing this completely wrong. Compression socks have been clinically proven to improve venous return, meaning the flow of blood back up from your legs to your heart, by up to 30% in adults with mild to moderate circulatory insufficiency. The problem is that most people who try them either buy the wrong grade, put them on at the wrong time, or take them off at the wrong time, negating most of the benefit. Here is the correct protocol. Put your compression socks on first thing in the morning, before you even stand up from bed. The moment you stand upright, gravity begins pulling blood downward, and pooling begins in your lower extremities. Getting ahead of that is the entire point. The ideal compression level for general circulation support is 15 to 20 millimeters of mercury for most adults over 60. If your doctor has recommended a higher grade, follow their guidance. But do not go out and buy the highest compression you can find, thinking more is better. Excessively high compression can actually be dangerous. The elevation component is equally important and equally misunderstood. When you rest or watch television, elevate your legs so your feet are above the level of your heart. This is not the same as having your feet on a footstool. You need your legs at an angle that encourages genuine drainage. Lying on your couch with your legs propped on 3 or 4 pillows, so your feet are clearly higher than your chest, for 20 to 30 minutes twice a day, can reduce ankle swelling and improve venous circulation measurably within just a few days. Number 5, nitrate-rich foods. Here is where we start getting into something that surprises most people. Your blood vessels need a specific compound called nitric oxide to function properly. Nitric oxide is the molecule that signals your arterial walls to relax and widen, allowing blood to flow more freely. Think of nitric oxide as the master switch for your circulation system. After 60, your body's ability to produce nitric oxide declines significantly. A study in the Journal of the American Medical Association found that adults over 60 produce roughly 50% less nitric oxide than adults in their 30s. That single fact explains more about why circulation problems increase with age than almost anything else. The good news is that certain foods are extraordinarily rich in dietary nitrates, which your body converts into nitric oxide. The most powerful of these are beets and beetroot products, leafy greens like arugula and spinach, celery, and pomegranate. Beetroot in particular has been studied extensively. A 2021 study published in the Journal of Nutrition found that drinking 200 milliliters of beetroot juice daily, roughly a small glass, improved arterial blood flow by an average of 32% in older adults after just 10 days. 10 days. The practical recommendation is this: 3 to 4 times per week, incorporate one of these options into your diet: a small glass of pure beetroot juice, a large handful of arugula or spinach as a salad base, 2 stalks of celery as a midday snack, or a small serving of pomegranate seeds. You don't need all of them every day. Rotating through them consistently is what matters. Common mistake to avoid: do not use antibacterial mouthwash before consuming nitrate-rich foods. This sounds strange, but the bacteria in your mouth play a critical role in converting dietary nitrates into nitric oxide. Studies have shown that people who use antibacterial mouthwash twice daily have significantly lower nitric oxide production and worse cardiovascular outcomes. Use mouthwash at night, not before meals. Now I want to tell you about a patient of mine. Her name was Patricia. She was 71 years old, a retired school teacher from Philadelphia. She came to see me because her feet had been cold for years, not just uncomfortable cold. She said it felt like wearing ice cubes instead of feet from October through April, and even in summer evenings. Her hands were the same. She had stopped being able to do the things she loved: morning walks, tending her garden, even sitting comfortably through her grandchildren's school events, because the cold and the aching in her legs made everything a misery. She had been told multiple times that this was just poor circulation due to her age, and that there wasn't much to be done about it beyond staying warm. She had drawers full of thermal socks and heating pads. Nothing gave her lasting relief. I put her on the nitrate protocol combined with the temperature contrast therapy we discussed, and I told her to give it 3 weeks before expecting to feel anything significant. 2.5 weeks in, she called my office. She said, "Dr. Ashford, I put on my regular socks this morning, not my thermal ones, regular cotton socks, and my feet were warm." She was almost whispering it, like she was afraid it wasn't real. 3 months later, she was back in her garden every morning. This wasn't a miracle. This was her vascular system finally receiving the raw materials it had been starved of. And you can experience exactly the same thing. Number 4. Omega-3 fatty acids and their specific anti-viscosity effect. Remember when I said that blood tends to become thicker and more viscous as we age? This is one of the primary reasons why small capillaries, the tiniest blood vessels that feed your skin, your nerves, and your peripheral tissues, become increasingly blocked and sluggish over time. The medical term is hyperviscosity, and it is far more common in adults over 60 than most people realize. Omega-3 fatty acids, specifically EPA and DHA, have a well-documented ability to reduce blood viscosity. They do this through multiple mechanisms: reducing platelet aggregation, meaning they make your blood cells less likely to clump together, lowering triglyceride levels, which directly affect blood thickness, and reducing systemic inflammation in the vessel walls themselves. A study published in the European Journal of Clinical Nutrition found that adults over 60 who supplemented with 2 grams of combined EPA and DHA daily for 12 weeks showed a 31% reduction in blood viscosity markers and a significant improvement in peripheral circulation scores. 2 grams of combined EPA and DHA daily. This is the threshold most studies cite as clinically significant. Most standard fish oil capsules contain only 500 milligrams of combined EPA and DHA per capsule, meaning you would need 4 capsules to reach that dose. Always read the label carefully. What matters is the EPA and DHA content, not the total fish oil amount. Look for a product that provides at least 1 gram of combined EPA and DHA per serving, and take it with your largest meal of the day for best absorption. Fatty fish, particularly wild-caught salmon, sardines, and mackerel, are the dietary source. 3 to 4 servings per week of these fish provides a meaningful contribution, though most adults over 60 benefit from supplementation in addition to dietary sources to reach the clinically effective threshold. Pro tip: take your omega-3 supplement with a meal that contains fat. Omega-3s are fat-soluble, and absorption can improve by up to 50% when taken alongside dietary fat rather than on an empty stomach. Before we continue, I want to make a quick request. If what you've heard so far is helping you see your circulation differently, I'm asking for 2 simple things. First, subscribe to this channel. My mission is to give adults over 60 clear, honest, actionable health information that most people never receive. Second, share this video. Think about someone you know who complains about cold feet, leg cramps, or swollen ankles. A simple share could genuinely change how they manage their health. Now let's keep going, because the top 3 on this list are where the real transformation happens. Number 3, the walking prescription, and why you're probably doing it wrong. Walking is universally recommended for circulation. But here's what almost nobody tells you. The way most adults over 60 walk for exercise is actually less than half as effective as it could be for vascular health. And in some cases, the pattern people fall into can even reinforce circulation problems. The issue is pace and interval. When you walk at a single comfortable pace for 30 continuous minutes, your vascular system adapts to that steady state and the cardiovascular challenge becomes minimal after a few weeks. You need what researchers call flow-mediated dilation stimulation. That means moments during your walk where blood flow demand spikes, forcing your vessels to dilate rapidly and repeatedly. Over time, this is what restores elasticity and builds new capillary networks. The solution is interval walking, and it is remarkably simple. During your normal daily walk, every 3 to 4 minutes, pick up your pace dramatically for 60 seconds. Walk as briskly as you safely can, fast enough that conversation feels slightly difficult, for just 60 seconds. Then return to your comfortable pace. Repeat this cycle throughout your walk. A study published in the Journal of Clinical Cardiology compared adults over 65 who walked at steady state versus those who used interval walking for 12 weeks. The interval walking group showed a 41% greater improvement in peripheral artery flow and a significantly higher score on the 6-minute walk test. Same total duration of exercise. Dramatically better vascular outcome. The additional element most people miss is foot strike and posture. When walking specifically for circulation, focus on pushing off powerfully through your toes and heel with each step. This activates the calf muscles, which function as a critical secondary pump for venous return. Your calves are sometimes called the second heart because of how powerfully they assist in pushing blood back up toward your chest. Engaging them deliberately with each stride makes your walk multiple times more effective for circulation than passive shuffling. I want to tell you about James. He was 74 years old, a retired postal worker from Boston, spent 32 years walking routes for the post office, and genuinely believed he had done everything right for his legs. But when he came to me at 74, both legs would swell significantly by midday, his ankles were frequently painful, and he had been experiencing what he described as dead leg syndrome, where his lower legs would go almost completely numb after 15 minutes of sitting. He was walking 30 minutes every morning already. Good for him. But he was walking slowly, steadily, and without any intentional intensity variation. I explained the interval walking protocol and the importance of his calf activation. He was skeptical. He told me, "Doctor, I've walked my whole life. I don't think I'm doing it wrong." 3 weeks later, he came back. "Doctor," he said, "I don't know what you did to me, but my legs haven't swelled once this week. My wife thinks I'm lying about something because she's never seen my ankles look this normal." What happened was simple. For 32 years, James had walked efficiently, conserving energy like a trained professional. What he had never done was challenge his vascular system intentionally. Once he started doing that, his circulation responded remarkably quickly. Your body wants to heal. It just needs the right signal. Number 2. Magnesium, the vascular mineral most seniors are catastrophically deficient in. I'm going to say something that might genuinely upset you if you think about it too carefully. Up to 75% of adults over 60 in the United States are deficient in magnesium. 75%. and magnesium is arguably the single most important mineral for healthy vascular function. Here is why this matters so profoundly. Magnesium serves as a natural calcium channel blocker. That means it regulates the amount of calcium that enters your smooth muscle cells, including the cells that line the walls of your blood vessels. When calcium floods these cells unchecked, which happens when magnesium is deficient, your blood vessels tighten and constrict. The result is elevated blood pressure, reduced peripheral blood flow, and dramatically increased risk of arterial spasm. This is the mechanism behind many cases of Raynaud's syndrome, the condition where fingers and toes go painfully cold and white in response to temperature or stress. A study published in the journal Nutrients found that magnesium supplementation in magnesium-deficient adults over 65 led to a 29% improvement in endothelial function, meaning the inner lining of blood vessels, and a measurable reduction in arterial stiffness within 8 weeks. Here's what concerns me about this statistic. Most standard multivitamins contain only 40 to 60 milligrams of magnesium, far below the 300 to 400 milligrams per day that research consistently identifies as the effective therapeutic dose for vascular benefits. And certain common medications actively deplete magnesium, including proton pump inhibitors for acid reflux, diuretics, and certain blood pressure medications. If you take any of these regularly, your magnesium status needs particular attention. The best supplemental forms for absorption are magnesium glycinate and magnesium malate. Both are highly bioavailable, meaning your body can actually absorb and use them, unlike the cheap magnesium oxide found in most budget supplements, which has an absorption rate of only around 4%. Magnesium glycinate also has the advantage of being exceptionally gentle on the digestive system. Dietary sources of magnesium include pumpkin seeds, which are the most concentrated source per gram of any common food, dark chocolate at 70% cocoa or above, almonds, avocado, and legumes. But for most adults over 60 who are already deficient, dietary sources alone are typically insufficient to restore optimal levels. Supplementation is usually necessary. Take your magnesium in the evening. Magnesium has a gentle, relaxing effect on smooth muscle tissue throughout the body, which means it can also improve sleep quality, reduce nighttime leg cramps, and lower the resting blood pressure that tends to spike in the early morning hours. Evening is when this mineral does its best work for your vascular system. I remember Linda, a 79-year-old retired nurse from Chicago. She came to me with a problem that her previous doctors had described as untreatable. Every night, without fail, she experienced leg cramps severe enough to wake her from sleep, sometimes multiple times per night. She had been dealing with this for 11 years. 11 years. Her feet and lower legs were also persistently cold, and she had noticed that even minor cuts on her feet were taking unusually long to heal. She was, as I suspected, severely magnesium deficient. Her dietary history showed almost no magnesium-rich foods, and she had been on a proton pump inhibitor for 7 years, which had been actively depleting whatever magnesium she was consuming. I started her on magnesium glycinate 300 milligrams in the evening with dinner. I asked her to let me know how she was doing in 2 weeks. 10 days later, she called. "I can't explain it," she told me. "The cramps are almost completely gone. I slept through the night 3 nights in a row for the first time I can remember in years, and my feet are warmer. I don't understand how a mineral I've never really thought about could do this." Her voice was shaking. I told her what I'll tell you now. This wasn't a miracle. This was her body doing exactly what it's designed to do, once it finally had the tools it needed. 11 years of suffering that could have been addressed in 2 weeks if someone had thought to look at her magnesium levels. That is why I refuse to stay silent about this. If you're finding this valuable, please hit that like button right now. And make sure you're subscribed, because what comes next is the single most powerful vascular intervention on this list. Number 1. The Burger's exercise protocol and why one study called it a 44% solution. What I'm about to describe is a specific sequence of leg movements that was originally developed in clinical settings for patients with severe peripheral artery disease. What researchers subsequently discovered was that this protocol produces measurable, significant improvements in peripheral circulation, not just for people with diagnosed vascular disease, but for any adult over 60 whose circulation has been gradually declining, and the results happen faster than almost anyone expects. Here is the mechanism. The Burger's exercise protocol works by exploiting the body's natural response to positional changes in blood flow. When your legs are elevated above your heart, gravity assists venous return, and the arteries must work harder to push blood downward against gravity. When your legs are then lowered below your heart, the opposite occurs, and arterial blood floods into the extremities. Rapidly alternating between these positions, done in a specific sequence, forces your peripheral blood vessels to open and close repeatedly in a way that mimics and ultimately restores the vascular responsiveness of a much younger cardiovascular system. A study published in the Journal of Vascular Surgery followed adults over 65 with compromised peripheral circulation who performed this protocol twice daily for 4 weeks. The results showed a 44% improvement in ankle brachial index, which is one of the gold standard measurements of peripheral arterial blood flow, and a 61% reduction in reported symptoms of cold feet, cramping, and leg fatigue. 44% improvement in 4 weeks. Twice a day. No equipment. No medication. No cost. Here is exactly how to perform the Buerger's exercise protocol. You will need a firm bed or an exercise mat on the floor and a chair or wall nearby for support during the standing phase. Phase 1. Lie flat on your back. Raise both legs straight up toward the ceiling, or as close to vertical as is comfortable for you. Support the back of your knees lightly with your hands if needed. Hold this position for 2 to 3 minutes. You may feel your feet becoming pale or slightly cool during this phase. That is normal. That is gravity doing its job. Phase 2. Sit up and lower your legs over the side of the bed or mat so they hang downward, below the level of your hips. You will likely notice your feet becoming pink or reddish and feeling warm as blood rushes in. While in this position, move your feet in circles, flex and point your toes, and open and close your toes as if gripping the floor. Do this for 3 to 5 minutes. Phase 3. Lie flat again with your legs extended at the same level as your body. Relax completely for 5 minutes. This is the recovery phase, and it is as important as the 2 active phases. This completes 1 cycle. 2 cycles per day is the clinical protocol, morning and evening. Each session takes approximately 15 to 20 minutes. The most common mistake people make is rushing through phase 2. The dangling position is where the primary therapeutic benefit occurs, and people often sit up and immediately want to stand and move around. You need the full 3 to 5 minutes in that position for the vessels to fully vasodilate and for blood to thoroughly perfuse the peripheral tissues. Do not rush it. Within the first week of consistent practice, most people report a noticeable improvement in foot warmth and a reduction in leg fatigue. Within 2 to 3 weeks, many notice that the discoloration and mottling of their skin has diminished. By 4 weeks, most people who have been doing this consistently show measurable improvements if they repeat the 30-second test we did at the beginning of this video. I have one more story to share with you. His name was William. He was 77 years old, a retired civil engineer from Seattle. He came to me in a state I can only describe as demoralized. He had been told by 2 different specialists that his peripheral artery disease was advanced enough that he was at risk of eventually requiring amputation of his left foot if things didn't improve. He was terrified. His wife was terrified. He couldn't walk more than a block without stopping because his left leg would cramp so severely he had to stand still for minutes before he could continue. He told me, "Doctor, I used to hike mountains. Now I can't walk to my mailbox without stopping." I started him on the complete protocol. The Buerger's exercises twice daily. Magnesium glycinate in the evening. The nitrate protocol with beetroot juice 3 times a week. And the interval walking, starting at just 5 minutes per session because that was all he could manage without pain. 8 weeks later, he came in for a follow-up. His ankle brachial index had improved significantly. His left foot, which had been constantly cold to the touch during his initial examination, was warm. He had walked 6 blocks the previous evening without stopping. He sat in my office and he said something I will never forget. He said, "I thought my legs were done. I thought that part of my life was over." He paused for a moment. Then he said, "I walked to the park yesterday. I sat on a bench and I watched ducks for 20 minutes. And I walked home. That was everything to me." That is why I do this work. Not because circulation is an interesting scientific topic. Because circulation is the difference between living your life fully and watching it happen from a chair. Now let me give you a clear, precise action plan so you leave this video knowing exactly what to do. Starting tomorrow morning, do the 30-second circulation test. Do it again in 4 weeks and compare your results. Note whether the capillary refill time, the skin discoloration, and the cramping response have changed. On day 1, add magnesium glycinate to your evening routine, 300 milligrams with dinner. If you're already on medication, especially diuretics or proton pump inhibitors, check with your doctor first, but know that magnesium supplementation is generally extremely safe and is chronically under-recommended in standard clinical practice. On day 2, begin the Burger's exercise protocol. Morning and evening, 15 to 20 minutes each session. Mark it on your calendar for 4 weeks. On day 3, add nitrate-rich foods. Beetroot juice 3 times that week, arugula or spinach salad 2 other days. On day 4, if you're currently taking any fish oil supplement, check your EPA and DHA content. Adjust your dose to reach 2 grams of combined EPA and DHA daily. If you're not currently supplementing, start. On day 5, switch your daily walk to the interval walking protocol. Even if your walk is only 10 minutes long, add those 60-second intensity bursts every 3 minutes. By day 7, add temperature contrast therapy to your morning shower routine. Within 3 days of starting this combined protocol, most people notice their feet feeling warmer in the evening. Within a week, leg cramps, particularly the nighttime kind, typically begin to reduce. Within 2 weeks, the swelling that accumulates in your ankles through the day should be visibly less. Within 4 weeks, if you repeat the 30-second test, most people see measurable improvement in all 3 markers. Do not make these critical errors. First, do not try everything at once and then stop after 3 days because it feels overwhelming. Add 1 element every day or 2, as I described. The combined effect compounds over time. Second, do not buy low-quality magnesium oxide supplements thinking all magnesium is equivalent. The form matters enormously, glycinate or malate. Third, do not skip the recovery phase of the Burger's exercise. All 3 phases are therapeutically necessary. Fourth, do not expect instant results from any single element. The power of this protocol is in its synergy and consistency. Give it 30 days. You are not broken. Your circulation protocol is broken. What you've been doing or not doing is broken. Your vascular system is extraordinary. It is resilient. It wants to function well. It simply needs the right inputs. Age does not disqualify you from having healthy circulation. I have patients in their early 80s with better peripheral blood flow than some people half their age because they committed to caring for their vascular health with the same seriousness they give to any other area of their life. Now I want to hear from you. Have you ever tried the Burger's exercise protocol before? And which of these 7 strategies are you going to start with tomorrow? Write your answer in the comments below. I genuinely read them, and your experience might be exactly what another viewer needs to hear to take their first step. Here is my challenge to you. Commit to this protocol for 30 days. Just 30 days. Redo the 30-second test at the start and again at the end. Pay attention to how your feet feel in the morning. Notice whether your legs feel heavier or lighter at the end of the day. Track whether you're walking farther and with less pain. 30 days. Your legs will thank you. Your independence will thank you. If this video helped you today, please do 3 things. Hit that like button. Subscribe to this channel so you don't miss the practical, science-backed health strategies we release every week specifically for adults over 60. And share this with someone you care about, because the 30-second test we did today might reveal something important for someone who doesn't yet know they need to look. Because remember, aging doesn't take away your body's ability to heal. It simply reminds you to take care of it the right way. Take care of yourself.